students, I am Priyanshi Baraskar and today we discuss about the genetics unit second. Okay, unit second is a maternal, prenatal and genetic influences on development of defect and diseases. Okay, in this maternal, prenatal and genetic influences that affect the development of fetus and diseases. Okay, so first, maternal disorder and infection affecting the fetus. Okay. So first we discuss about the maternal disorder and infection, those who affects the fetus. Okay. In this first, maternal disorder affecting fetal. So first disorder is diabetes mellitus. It is a maternal diabetes. Okay. It is also called gestational diabetes. Okay. High blood glucose levels in the mother can cross the placenta. Okay. In which high blood glucose levels in the mothers can cross the placenta, may cause congenital malformations such as heart defects, neural tube defects, or macrosomia. It means large babe. Okay, so this high blood glucose level is crossed to the placenta. Okay, then they cause the congenital malformations such as heart defects, neural tube defects, or macrosomia. It means large baby. Okay, second, hypertension and preeclampsia. Okay, it is poor supply to the placenta affect fetal growth. Okay, in this poor blood supply to the placenta affects fetal growth, can cause intrauterine growth retardation. Okay, which can cause intrauterine growth retardation. It called IUGR and low birth weight. Okay. Severe cases may lead to premature delivery or stillbirth. Okay, in this severe cases they lead to the premature delivery or stillbirth. Okay, then third is maternal obesity. Okay, the increased risk of neural tube defect, congenital heart diseases, and diabetes in the fetus. Okay, maternal obesity also increase the risk of neural tube defect, congenital heart disease, and diabetes in fetus. Then next discuss about the maternal infection affecting fetal. Okay, in this first rubella also called German measles. Okay, first causative agent rubella virus. Okay, then viral infection interferes with DNA synthesis and organ formation. This virus infection interferes with the DNA synthesis and organ formation. Then second is varicella, it is called chicken pox. Take a causative agent, varicella zoster virus. In this virus disrupts cellular DNA during fetal organ formation. Okay. In this virus disrupts cellular DNA during fetal organ formation. Okay. So we discuss about the maternal diseases and infection affecting fetal. Okay. Then next topic is consanguinity. Consanguinity means the union between two individuals who are biologically related by blood. They share a common ancestor. Okay, consanguinity means blood share. Okay, they share bloods. In genetics, it refers to marriage or reproduction between relatives such as cousin, uncle, niece. Okay. In genetics, it refers to marriage or reproduction between relatives such as cousins, uncle, niece, etc. Okay. The next topic is prenatal testing and diagnosis in genetics. Okay, we discuss the prenatal testing and diagnosis in genetics. Prenatal testing and diagnosis in genetics refers to medical procedures done during pregnancy to detect genetic or chromosomal abnormalities in the developing fetus before birth. Okay. In this, prenatal testing, diagnosis, and genetics refers to medical process. It is a medical procedure done during pregnancy to find out and detect the genetic or chromosomal abnormalities in the developing fetus before birth. Okay, in this two types of procedure, in non-invasive procedure and invasive procedure. So first, non-invasive testing. In this, first ultrasonography and MRI, and non-invasive testing in this including amniocentesis. Then next topic is neural tube defect in genetics. NTD is also called. Definition: neural tube defect are a group of birth defect of the brain. It is a birth defect of a brain, spine or spinal cord that occur when the neural tube fails to close properly during early embryonic development by the third or fourth week of pregnancy. Okay, they affect the brain, spine or spinal cord in the failure of the neural tube closed properly by the third or fourth weeks of pregnancy. Okay, then types of NTD: open NTD and closed NTD. There are most common types of NTDs occur when the brain or spinal cord are exposed at birth through a defect in the skull or vertebra. These are most common type of NTDs. They can occur the brain or spinal cord are exposed at birth through a defect in the skull or vertebra. And second type is closed NTD. They are rare type of NTDs. Closed NTD occur when the spinal defect is covered by skin. Okay, in this closed means the spinal cord is covered by the skin, and open NTD in this exposed to the birth. Then next, pathogenesis. The pathophysiology involves a failure in the complex process of neural tube closure, which can be influenced by a combination of genetic and environmental factors such as folate deficiency, maternal diabetes, certain medications, and obesity. Okay. Then diagnostic evaluation: alpha fetoprotein in the amniotic fluid and maternal serum. We can diagnose this through the alpha fetoprotein and amniotic fluid and maternal serum and high resolution ultrasound. Then, so today we discuss about the genetics unit second, which is maternal prenatal genetic testing or development. Okay, in this included maternal disorder and infection affecting the fetus, and consanguinity and prenatal testing and diagnosis in genetics. And then NTD, neural tube defect. Neural tube defect in this definition: types of NTDs, pathogenesis, diagnostic evaluation, and treatment. In this treatment protruding sac can be closed surgically, after which assessment of growth and development should be continued. Okay, which in this protruding sac can be closed surgically, after which assessment of growth and development should be continued. Supportive measures should be taken to prevent complication. In the supportive measures also provided to prevent the complication of NTD and neural tube defect.